My name's Steve Lewis. I'm a consultant ear, nose and throat surgeon practicing in Worcestershire. Why did I specialise in otolaryngology? Well, I think I decided fairly on in my training that I was going to be a surgeon rather than anything else. As a junior doctor, one trains in different specialties, and I was taken by ENT quite early in my ENT attachment. I think one of the things I enjoy most is that it's an extremely varied specialty where we undertake quite a lot of clinic work and speak to patients rather than just doing operations. And when we get to operative surgery, there are large operations, there are small operations, there's microscopic operations. It's extremely varied. I particularly enjoy the challenge of diagnosis with my patients. In other areas of medicine, general practitioners refer a patient to a specialist with an idea of the diagnosis, and they're looking for a complex treatment plan. In ENT, quite commonly, without examination and kit such as a microscope or a flexible nasendoscope, it's difficult to make a diagnosis. So the important part of my job is to translate the patient's problems into a diagnosis and then formulate a treatment plan. I particularly enjoy working with the patient to get from the start to the end of that process. ENT throws up a variety of challenges. The primary one is really of diagnosis. Patients describe symptoms, and usually by the time they've got to the end of a description, we have a reasonable idea of what's going on, and then we confirm that with examination and special tests. But certainly in cases of imbalance or dizziness, that can be quite a long conversation before we get to the right diagnosis.